some of these people had cancer, and that there is a real role for looking at these anti-parasite things.
But do they have a chance? I mean, I'll go to Doctor. Do these therapies have a chance? I mean, with Big Pharma, again, demanding random control trials, forget the observational stuff, only expensive patentable drugs.
I stay open-minded. I mean, just up the road from here at Johns Hopkins, one of my colleagues has been looking at mebendazole for brain cancer. I mean, these agents do affect the immune system, and we need to learn about them and study them.
Well, how are we going to do this? I mean, we're going to make this available to the people who just want to try something different. I mean, again, people are having. I know they can't get these kind of treatments. They have to go to just a very few doctors who are willing to do it. I mean, the cancer centers won't do it. Is that largely true? I mean, Dr. Graylow, I'm really not picking on you now. What can we do? I mean, is this something that your society is looking at? I mean, would they look at, cheap generic drugs that don't have the type of toxicity that some of these chemotherapies have?
I think this speaks to the role of the need to sustain federal funding. I agree. Industry is not going to do those trials. They don't have a vested interest in it. These are cheap drugs. These are the kinds of trials that our government should fund.
By the way, I completely agree as long as that funding isn't corrupted in some way, shape, or form,
I will tell you that at last year's big annual meeting, we had very preliminary data in a subset of breast cancer looking at an immune checkpoint inhibitor with ivermectin added. It showed there were some responses. It did not prove the responses were any higher than if it was immunotherapy alone, but they proved a safe dose and combination, and that trial, which is federally funded, will continue to try to see if it was more than the immunotherapy alone.
I'll just tell you, because patients are just begging for it. They really are. They just, a lot of people are just saying, I'm not going to be treated at all.